I want you to think about something for a moment. Your kidneys are working right now, filtering your blood, removing waste, balancing fluid, regulating your blood pressure, producing hormones that keep your bones strong and your red blood cells healthy. They have been doing this every single minute of every single day since before you were born. And here is the terrifying part. They can lose up to 90% of their function before you feel sick enough to go to a doctor. 90%. By the time most people are diagnosed with chronic kidney disease, they have already lost the majority of their kidney function, not because they ignored obvious symptoms, but because kidney disease in its early and middle stages produces symptoms so vague, so easy to explain away, so similar to ordinary aging, that even careful, health-conscious people miss them completely. Right now, 37 million Americans have chronic kidney disease, that is 1 in 7 adults, and 9 out of 10 of them do not know it. Today I am going to show you the 10 silent signs that your kidneys are struggling, signs that appear months and sometimes years before a diagnosis, signs that your body is sending right now that you may be dismissing as tiredness, aging, or stress. Stay with me until the end, because catching this early is the difference between reversing it and managing it for the rest of your life. Subscribe and hit the like button right now. This channel exists to give you what a 12-minute doctor's appointment never has time to deliver. Let me tell you about a patient I will call George, 74 years old, retired postal worker, type 2 diabetic for 11 years, managed with medication, blood pressure slightly high but controlled, generally felt he was doing well for his age. George came to me not because he thought something was seriously wrong. He came because his wife made him. She had noticed things he had not. She noticed that his ankles looked puffy most evenings. He said it was from being on his feet all day, even though he had been retired for 6 years. She noticed that his eyes looked slightly swollen every morning when he woke up. He said he was just not sleeping well. She noticed that he seemed more forgetful than usual, losing track of conversations, repeating himself. He laughed it off, said it was just age. She noticed that his skin had been itchy for months, particularly his legs and arms at night. He had been using moisturizer, assuming it was dry skin from the winter, and she noticed that he barely touched his dinner most evenings, said food just did not taste right lately, everything tasted slightly metallic or flat. George had been living with every single one of these symptoms for over a year. He had an explanation for each one. None of them felt serious enough on their own to warrant a doctor visit. When I ran his blood work, his eGFR, the measure of kidney filtration function, came back at 28. Normal is above 90. George was in stage 4 chronic kidney disease. His kidneys were functioning at less than 30% of their normal capacity. He had been losing kidney function gradually for years, silently, without drama, without pain. His wife saved his life by paying attention to signs he had learned to ignore. After today, you will know exactly what those signs are, and you will never ignore them again. Before we go through the 10 signs, I need to explain why kidney disease is so silent, because understanding the mechanism will help you take the signs more seriously when you see them. Your kidneys contain approximately 1 million tiny filtering units called nephrons. Think of each nephron as a microscopic cleaning station. Blood flows in, waste products are filtered out, clean blood flows back into circulation, and the waste leaves the body as urine. When nephrons are damaged by high blood pressure, by diabetes, by chronic inflammation, by certain medications, they do not repair themselves. They scar, and the remaining healthy nephrons compensate by working harder. This compensation is remarkable. And it is also the reason kidney disease is so silent, because the remaining healthy nephrons can expand their capacity significantly. They filter more, they work overtime, and for a long time, years in many cases, they maintain kidney function well enough that standard symptoms do not appear. Your body does not raise an alarm because the system has not yet failed. It is struggling, compensating, working harder than it should, but it has not failed. By the time symptoms appear strongly enough to be unmistakable, a significant portion of those compensating nephrons have themselves been damaged by the extra workload, and unlike most other cells in the body, nephrons cannot regenerate. This is why early detection is everything with kidney disease. Every nephron you preserve by catching the problem early is kidney function you keep for the rest of your life. The two biggest drivers of kidney damage in people over 55 are high blood pressure and diabetes. Both damage the delicate blood vessels that feed the nephrons. Both do their damage slowly and silently, and both are present in a significant portion of the audience watching this video right now. If you have either condition, what I am about to share is not general health information. It is specific and urgent information about your body right now. Let us go through the 10 signs. Sign number 1. Swelling around the eyes in the morning. This one is specific and important and almost universally missed. Healthy kidneys filter protein and keep it in the bloodstream where it belongs. When the kidney filters are damaged, protein, specifically albumin, begins leaking through into the urine. Protein in the blood plays a critical role in maintaining what is called oncotic pressure, the force that keeps fluid inside your blood vessels rather than leaking into surrounding tissue. When protein levels in the blood drop because the kidneys are letting it escape, fluid leaks out of the blood vessels and accumulates in the surrounding tissue. And because the tissue around the eyes is particularly loose and delicate, this is often the first place that fluid accumulates visibly. You wake up in the morning with puffy, swollen-looking eyes, not from crying, not from allergies, from protein leaking through damaged kidney filters overnight. The medical term is periorbital edema, and it is one of the earliest visible signs of kidney dysfunction. Most people blame it on poor sleep, salt intake, or aging, and sometimes it is, but if it is a new pattern, if it is persistent, if it appears most mornings and fades through the day, it deserves a urine test checking for protein. George's wife noticed his puffy morning eyes for months before anyone connected it to his kidneys. Sign number 2, foamy or bubbly urine. This one requires you to pay attention to something most people never look at twice. When you urinate, look at the water in the toilet bowl. Normal urine produces a small amount of foam that dissipates quickly. Foamy, persistently bubbly urine, foam that looks similar to the head on a beer and lingers for more than a few seconds, is a visual sign of protein in the urine. The same mechanism as sign number 1. Protein leaking through damaged kidney filters into the urine changes its surface tension and produces persistent foam. This is one of the clearest early warning signs of kidney damage, and it is one that you can observe yourself in your own bathroom every single day. If your urine has been consistently foamy or bubbly for more than a few weeks, that is a direct reason to ask your doctor for a urine albumin to creatinine ratio test. It takes one urine sample and it directly measures protein leakage from the kidneys. Sign number 3, persistent itching, especially at night. This one surprises people because they think of itching as a skin problem. When the kidneys cannot filter waste products efficiently, those waste products accumulate in the bloodstream. One of the most problematic is a compound called urea, a nitrogen-containing waste product of protein metabolism. Elevated urea levels in the blood, a condition called uremia, causes urea to be deposited in the skin, and urea in the skin is intensely irritating to nerve endings. The result is a persistent, deep itching that is not relieved by moisturizer, antihistamines, or scratching. It tends to be worse at night when the body is still and there are fewer distractions. It affects the legs, arms, and back most commonly, and it does not look like a rash. The skin may appear completely normal while the itching is severe. George had been using moisturizer on his legs for months. His dermatologist had prescribed a topical cream. Nobody had checked his kidney function. If you have persistent itching that no skin treatment relieves, especially combined with any other signs on this list, kidney function testing is essential. Sign number 4, extreme fatigue and brain fog. The kidneys produce a hormone called erythropoietin, EPO. This hormone signals the bone marrow to produce red blood cells. Red blood cells carry oxygen to every tissue and organ in the body, including the brain. When the kidneys are damaged, erythropoietin production drops. Red blood cell production drops with it. The result is anemia, a shortage of oxygen-carrying capacity in the blood. Anemia from kidney disease produces a specific type of fatigue, not the tiredness of a busy day, a profound, persistent exhaustion that sleep does not relieve, a heaviness that makes even simple tasks feel disproportionately difficult. Alongside the fatigue comes cognitive impairment, what patients describe as brain fog, difficulty concentrating, trouble finding words, feeling mentally slow or unclear, short-term memory that seems worse than it should be. Most people over 60 attribute these symptoms to aging, and sometimes they are simply aging, but new or worsening fatigue and brain fog in someone with cardiovascular risk factors, high blood pressure, diabetes, history of heart disease, should always include kidney function in the workup. George's increasing forgetfulness, his wife's concern that he seemed different, that was his brain running low on oxygen because his kidneys had stopped telling his bone marrow to make enough red blood cells. Sign number 5, changes in urination pattern. We talked extensively about nighttime urination in our first video, but kidney disease produces specific changes in urination pattern that go beyond simply getting up at night. Increased frequency, particularly at night, can indicate that the kidneys are losing their ability to concentrate urine efficiently. They produce more volume to excrete the same amount of waste. Decreased urination, producing less urine than usual, or urine that is darker and more concentrated, can indicate that the kidneys are struggling to maintain adequate filtration. Blood in the urine, visible as pink, red, or brown discoloration, can indicate that the kidney filters are damaged enough to allow red blood cells to leak through. Urine that is consistently dark amber or brown, even when you are drinking adequate fluid, can indicate significant waste accumulation. Any new or changed pattern of urination deserves attention. And if you watched our first video and recognized yourself in the nighttime urination discussion, please make sure your doctor includes a kidney function panel in your next blood work. Sign number 6. Persistent lower back pain, but not where you think. People commonly associate kidney pain with the lower back, and they are right, but the location is more specific than most people realize. Kidney pain is felt in the flank, the area on either side of the spine, roughly at the level of the lower ribs, not the very bottom of the back where most people experience muscular back pain. Higher, deeper, a dull, persistent ache that does not change with movement or position the way muscle pain does. Kidney pain can also radiate around to the front of the abdomen or down toward the groin, depending on the cause. Important distinction: most lower back pain is muscular or spinal in origin and has nothing to do with the kidneys. But a persistent deep ache in the flank area, especially combined with other signs on this list or with fever and chills, warrants kidney investigation. Sign number 7. Metallic taste in the mouth and loss of appetite. This is one of the most specific signs of significant kidney dysfunction, and it is the one that most clearly signals waste accumulation in the bloodstream. When urea and other waste products build up in the blood to sufficient levels, they affect taste perception directly. Food tastes metallic, flat, or simply wrong. Things that used to taste good become unappealing. The appetite diminishes because eating feels unrewarding. Some people also notice that their breath has a slightly ammonia-like quality, sometimes described as smelling like urine. This occurs because urea in the bloodstream is converted to ammonia in the saliva. George had stopped enjoying his meals for months. Everything tasted slightly off. He had lost several pounds without trying. He assumed it was his diabetes affecting his digestion. It was his kidneys failing to clear waste from his blood. If you have noticed a persistent metallic taste, a significant change in how food tastes, or a loss of appetite that has developed over weeks or months, please include kidney function in your medical evaluation. Sign number 8. Muscle cramps, especially at night. When the kidneys are not functioning properly, the balance of electrolytes in the blood is disrupted. Specifically, calcium, phosphorus, potassium, and sodium levels can all become abnormal as the kidneys lose their ability to regulate them precisely. One of the most common results is muscle cramping, particularly in the legs and particularly at night. The cramps associated with kidney dysfunction tend to be severe, prolonged, and resistant to the usual remedies like stretching or hydration. They may affect the calves, the feet, or the thighs. Most people blame nighttime leg cramps on dehydration, magnesium deficiency, or simply aging, and again, sometimes they are. But persistent, severe nighttime leg cramps in someone with cardiovascular risk factors should prompt kidney function testing. Sign number 9. Shortness of breath without obvious cause. Kidney dysfunction causes shortness of breath through 2 separate mechanisms, and understanding both helps you recognize this sign more clearly. The first mechanism is the anemia we discussed in sign number 4. When red blood cell levels drop, the body compensates by breathing faster and more deeply to try to deliver more oxygen to tissues. The result is breathlessness, particularly with exertion. The second mechanism is fluid accumulation. When the kidneys cannot regulate fluid balance properly, excess fluid can accumulate in the lungs, a condition called pulmonary edema. This produces a sensation of breathlessness that can be worse when lying flat and may be accompanied by a persistent cough. If you find yourself more breathless than usual during activities that previously caused no difficulty, and particularly if this breathlessness is worse when lying down, please seek medical evaluation promptly. Sign number 10. High blood pressure that is suddenly harder to control. This final sign is specifically for those of you who are already managing high blood pressure with medication. The kidneys play a central role in blood pressure regulation. They produce a hormone called renin that is a key part of the system that controls how constricted or relaxed your blood vessels are. When the kidneys are damaged, this regulatory system is disrupted and blood pressure tends to rise. If your blood pressure has been well controlled for years on the same medication and dose, and recently it has been running higher, requiring dose increases or additional medications, that change in control can be an early sign of declining kidney function affecting blood pressure regulation. This is a subtle sign, easy to attribute to stress, diet, or simply the progression of hypertension. But a sudden loss of previously stable blood pressure control should always include a kidney function check. Now that you know the 10 signs, I want to be specific about who needs to be most alert. People with diabetes, diabetic nephropathy, kidney damage caused by chronically elevated blood sugar, is the single leading cause of kidney failure in the developed world. High blood sugar damages the delicate blood vessels feeding the nephrons slowly and relentlessly over years. If you have had type 2 diabetes for more than 5 years, your kidneys need to be checked annually without exception. People with high blood pressure. Hypertension is the second leading cause of kidney failure. Chronically elevated pressure in the blood vessels damages the kidney filters progressively. If your blood pressure has been above normal for years, even if it is medically managed, your kidney function deserves regular monitoring. People over 65, kidney function naturally declines with age. The average person loses approximately 1% of kidney filtration capacity per year after age 40. By 65, the kidneys are already working with a reduced reserve. Any additional stress, an infection, a period of dehydration, a new medication can push reduced kidney function into overt kidney disease. People who take NSAIDs regularly, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, aspirin in high doses, are among the most common causes of medication-related kidney damage. These medications reduce blood flow to the kidneys and with regular use can cause significant cumulative damage. If you take these medications regularly for arthritis, back pain, or joint pain, please discuss kidney protective alternatives with your doctor. People who have had repeated urinary tract infections. Chronic or repeated kidney infections can cause scarring of kidney tissue over time. If you have had multiple UTIs or kidney infections over the years, your kidney function deserves periodic evaluation. Here is exactly what to ask your doctor for. Walk in with these specific requests. Test 1. eGFR, estimated glomerular filtration rate. This is the primary measure of kidney function. It estimates how much blood your kidneys are filtering per minute. Normal is above 90. Between 60 and 90 is mildly reduced. Below 60 is chronic kidney disease. Below 30 is severe. Below 15 is kidney failure. This is measured from a standard blood test, creatinine, that is often already included in routine blood work. Ask your doctor specifically, what is my eGFR? Many people have had this number measured and nobody explained what it means. Test 2. Urine albumin to creatinine ratio. This measures protein leakage from the kidneys. It requires a single urine sample. A ratio below 30 is normal. Between 30 and 300 indicates moderate kidney damage. Above 300 indicates severe damage. This test directly measures the kidney filter damage we discussed in signs 1 and 2. It is simple, inexpensive, and enormously informative. Ask for it by name. Test 3. BMP or CMP, Basic or Comprehensive Metabolic Panel. This blood panel measures sodium, potassium, calcium, bicarbonate, and other electrolytes alongside kidney function markers. It gives a complete picture of how well the kidneys are maintaining the body's chemical balance, the balance disrupted in signs 7 and 8. Test 4. Kidney ultrasound. If blood work raises concern, a kidney ultrasound is the next step. It shows the size and structure of the kidneys, whether they have shrunk, whether there are cysts, stones, or obstructions affecting function. It is non-invasive, painless, and widely available. 4 tests: eGFR, urine albumin to creatinine ratio, comprehensive metabolic panel, kidney ultrasound if needed. Write them down. Bring them to your next appointment. I want to end this video not just with what to watch for, but with what you can do starting today to protect the kidney function you have. First, control your blood pressure obsessively. Every point of blood pressure reduction reduces the rate of kidney damage. Target below 130/80 if you have kidney disease or diabetes. Take your medication consistently. Measure your blood pressure at home regularly. Do not skip doses. Second, control your blood sugar if you are diabetic. HbA1c below 7% significantly slows the progression of diabetic kidney disease. Work with your doctor to achieve and maintain this target. Every percentage point matters. Third, stay well hydrated, but not excessively. Mild chronic dehydration concentrates the urine and increases the workload on the kidneys. Drink enough water to keep your urine a pale yellow color throughout the day. Dark yellow or amber urine is a sign you need more fluid. Excessive water intake is equally harmful. It forces the kidneys to work overtime. You do not need 8 glasses if you are not thirsty. Pale yellow is the target. Fourth, reduce your protein intake at dinner. The kidneys process protein waste, urea, as their primary filtering job. Excessive protein, particularly from red meat, increases the filtration burden on already stressed kidneys. Shifting toward plant protein sources, fish, and poultry reduces this burden without compromising nutrition. Fifth, avoid NSAIDs whenever possible. Ibuprofen and naproxen taken regularly are genuinely damaging to the kidneys. Discuss alternatives with your doctor. Acetaminophen, paracetamol, is generally safer for kidney function when taken at appropriate doses. Sixth, get your kidney function checked annually. If you have diabetes, high blood pressure, or are over 65, once a year. eGFR and urine albumin. That is all it takes to catch a problem while it is still reversible. George is still managing his kidney disease. At stage 4, the damage cannot be fully reversed, but with medication adjustment, dietary changes, and careful blood pressure and blood sugar control, his kidney function has stabilized. He has not progressed to dialysis. His nephrologist is cautiously optimistic. His wife sat in on that first appointment with me. At the end, she asked quietly, "If we had caught this 2 years earlier, would it have been different?" The honest answer is yes. Almost certainly yes. 2 years earlier, his eGFR was probably in the 40s or 50s, chronic kidney disease stage 3. With the right interventions at that point, significant function could likely have been preserved. The trajectory could have been changed. 2 years of dismissed morning puffiness, 2 years of explained away itching, 2 years of metallic taste that must have been the medication, 2 years of signs that nobody connected. You now know what those signs are. You know what tests to ask for. You know who is most at risk. And you know what to do starting today to protect the function you have. Your kidneys have been working for you every minute of your life without asking for anything in return. It is time to return the favor. Your action steps from today. 1. Go through the 10 signs honestly. Morning eye puffiness, foamy urine, persistent itching, fatigue and brain fog, changes in urination, flank pain, metallic taste, muscle cramps, unexplained shortness of breath, blood pressure suddenly harder to control. How many apply to you in the past few weeks? 2. If 2 or more apply, call your doctor this week and ask specifically for an eGFR blood test and a urine albumin to creatinine ratio. 3. If you have diabetes or high blood pressure and you have not had kidney function checked in the past year, make that appointment today. 4. Share this video with someone who has diabetes or high blood pressure. You may not know whose kidneys you are protecting by doing so. 5. Subscribe and hit the like button. Leave a comment below telling me, did any of these 10 signs surprise you? Which ones have you been dismissing? I read every comment. Your responses shape what comes next on this channel. Your kidneys are working for you right now. Make sure you are working for them. I will see you in the next video.